2 years after lumbar fusion surgery, I continued to live with chronic pain, severe muscle spasms, and the daily challenges of recovery. In this first video, I'm sharing my story, showing real footage of the spasms I experience, and explaining why I've started this channel. My goal is to document this journey honestly, the setbacks, the victories, the doctor visits, treatment options, and everything I learned along the way, and have learned along the way. If you're facing spine surgery, recovering from lumbar fusion, dealing with adjacent segment disease, chronic pain, or muscle spasms, I hope my experiences help you feel less alone and encourage you to keep searching for answers. Thank you for watching, and I hope you'll join me as I navigate life after spinal surgery, one day at a time. Hey there, I just wanted to do a quick video here to welcome you to my nightmare. I have pretty massive back spasms now. My condition has deteriorated after the last couple months, so it sucks. Anyway, so that's why I'm talking to you in bed, because I spend a lot of time in bed. It sucks. Well, actually, it's not too bad. I mean, life could be worse, but yeah, after my surgery, it's my anniversary, almost my anniversary of 2 years after my 4 lumbar fusion and failed lumbar fusion, 4 lumbar fusion that never should have happened. But anyway, because I was naive and I didn't know what the hell I was doing, I thought that everything would be okay, that I would have the surgery and my tingling and twitching and all that crap that was going on with both my legs, because of my back, would go away. And I trusted the doctor, which I should not have done. And I was in a hurry because I was losing my job and I needed to get the surgery done. Because I knew I needed the surgery. I found out about, 4 years that I had severe spinal stenosis. And it's a sucky disease or whatever it is, because I don't know if it's a disease or whatever, birth defect, but you don't know that you have it until it's like too late, until you have usually severe spinal stenosis, and that because your hands tingle or your legs tingle or whatever because the nerves are pinched. And so people don't know until they have those symptoms. But anyway, so I found out about 4 years ago, and then 2 years ago I had the 4 lumbar fusion just before I lost my health insurance. I guess that's good. It's not good because I got hurt. The surgery hurt me, but anyway, so because the surgery hurt me, I want to do videos on my experience living with, basically deteriorating adjacent segment disease, which is repercussions or a failed back surgery from the lumbar fusion. There's about, I guess, a 20% chance or 30% chance of failure that I didn't know of before I did the surgery, because my doctor didn't talk to me. All he did was call me on my cell phone 5 days prior to surgery in the car with his wife and kids, saying, "Hey, I talked to some of my colleagues and I think we should do a much larger surgery, a full lumbar fusion." So yeah, that basically he did it for the money, I think, but whatever, that's my opinion. So I have this ramification of severe muscle spasms. I had them before the surgery, but I didn't know what they were. And then when I found out I had spinal stenosis, then I went to a neurosurgeon and I saw the MRI, and it showed a pinched nerve, obviously, but or spinal cord, I should say. So it's a spinal cord injury. That's what they call it, spinal cord injury, SCI. I had no idea. I had surgeries. I had about 13 surgeries between the ages of 13 and 20 years old. So for 7 years, I had a surgery every 6 months back to back when I was a child or teenager. And then I just pushed through the pain for 30 years until 2 years ago when I had my back surgery. So, I was able to push through the pain of, having all those surgeries and stuff. But then when the back happened, it totally changed my life. So anyway, I thought it was just another orthopedic surgery, just another hip surgery or knee surgery. It's bone related. Get in there and put some hardware in there and fix the problem, because that's what I was accustomed to. And I had no idea. I was so naive. I had no idea that this really even included the spinal cord, to be honest with you. It just didn't register with me. The paralysis or spinal injuries did not register. I thought, okay, yeah, there's nerves, but I mean, it just wasn't at the forefront of my mind that this is a really, really serious surgery. I did not think that. I thought it was serious, but I thought, they know what they're doing. I mean, I didn't know the full ramifications of what I was getting into. And that's why I'm doing these videos. That's why I'm going to do a series of videos, so that you guys know what not to do. And I'm actually going to make a PDF and, try to give you as much information as I can, so that you can make an informed decision for yourself, so you don't have to go through this, because it's not fun. So that's my whole reason for doing these videos. I'm really not keen on showing myself, but I guess I will now, because I do have something to say, and I think what I have to say about my experience living with this will benefit other people, and I really want to do that. Basically, my overall arching message is, slow down, get a second, third, fourth opinion, and make an informed decision. Don't be an idiot like me and just trust and go with it and do it. It's a very serious surgery. I didn't even know, like I said, I didn't know that my surgery really, was that intense, as far as nerves and that could be damaged, or, ramifications that could happen after the surgery. I was actually, about 4 or 5 months, I went to the movies, and I saw the Superman movie with Christopher Reeve. And it was his documentary on his spinal cord injury. And I went to the movie just because I wanted to see it. I like documentaries, and I like seeing documentaries, and I like Christopher Reeves. And so I went to the movie, and I'm sitting there 40 minutes. This is how stupid I am. I'm sitting there like 40 minutes into the movie, and I figure out to myself, yeah, that's what I have. I have a spinal cord injury. So I actually, the first time I put a name to what happened to me after surgery, because it basically happened after, my problems happened from surgery. And so I have spinal cord injury from surgery. But I didn't realize that. I thought I was still healing and, whatever, anything was good. But then when I watched the movie and I related so much to the things, I mean, not everything, obviously, because he was a lot worse, but yeah, I just thought, wow, yeah, that's what I had. I had to mess with my spinal cord. That's serious. So anyway, I don't want anybody to be this naive like I was. So anyway, I'm going to do a whole series of videos, so watch out for those. And this video, like I said, I wanted to document my current state of affairs. And what I did was I took a video of me, probably like 30, 35, 40 minutes of me laying on my right side, my stomach, and my left side all in one shot in about 35 minutes, I would say. And then what I did was the spasms happen within 15 seconds. So they happen one every 15 seconds or one every 5 seconds or whatever. So instead of showing you the whole 35-minute video, I cut it down. I cut each spasm basically down to itself, so that you can see what they're like for me. And like I said, spasms are different for everybody and all different kinds. So anyway, I just wanted to kind of show you what I'm going through. So there you go. That's the first video. And so look for more. And I'll name them and get more, detailed and better at different subjects as I go along. So here's my back spasms.